Hey everybody, it's an amazing day. And it was made even greater because today I'm beginning a pathway series that I hope to continue. Through it, I'll be meeting with individuals at different stages and on different paths in their medical journey. And through it, I hope that anyone watching will be able to understand the diverse opportunities allotted through medicine. And I hope to learn the reasons behind their decisions. Because truthfully, if you're a future doctor and or researcher and somebody asks about your plans, your best answer is one that shows understanding. So, today I had the opportunity to talk to Dr. Allison Carey, MD, PhD, who will kick off this series by leading us through the typical pathways an MD or an MD PhD may take. Heading a research group at the University of Utah, Dr. Carey's lab has a focus on microbacterial genetics. She's also a pathologist at ARUP Laboratories. Receiving her bachelor's from Penn State University in biochemistry, Dr. Carey went on to complete her MD PhD at Yale, her pathology residency at Massachusetts General Hospital, and her microbiology postdoc at Harvard School of Public Health. So, yeah, she's pretty impressive. Hi, Dr. Carey.
Hi, how are you?
I'm good. How are you?
I'm doing well. I'm excited to chat with you about physician scientist pathways.
Thank you for joining.
Yeah, happy to be here.
So, I know that you have some slides prepared. If you could share your screen, that'd be amazing.
Yes. Let me just do a presenter view. Yeah, so I just go ahead?
Mm-hmm.
Okay. Yeah, so, as a physician scientist, it's a long training period, and I think that there are several considerations and sort of important inflection points along the way. And from my experience, here are some of the things that I think that it's good to think about at each of the steps of this long training pathway. So, I think when you're an undergraduate, you definitely want to make sure that you're getting both research experience and clinical experience. So research experience could be in the lab, it could be computational research experience, whatever gets you excited about biomedical research. And it can be great to do that at your home institution, but also make sure you look out for programs outside your institution. The National Institutes of Health has some great summer programs, and there are a lot of other really cool summer programs that you can look at if you don't have opportunities at your own college or university. And then it's important, since you're applying to potentially physician scientist training programs, to get some clinical exposure. And this is really just to make sure that you have an understanding of what the lifestyle of being a physician is and what it's like to help patients, and really start to understand a little bit about what your career path would look like when your training is done in the clinical realm. So you really want to kind of check those two boxes and get both types of experience. And then you make a decision. You're going to apply to potentially medical school for an MD program, an MD PhD physician scientist program, or maybe you fall in love with your lab work and research and you decide you just are going to ditch clinical care and go for a PhD. And I think that they're all great options. I think you want to rely on your experiences that you got as an undergraduate to help you kind of guide your decision and which path is best for you. I think whatever you do, you want to make sure that you're going to a supportive program. And what I mean by that is that you're going to an institution that understands what your career goals are, what your clinical or research interests are, and that they are on board with that and support you enthusiastically in that plan with that dream that you have. And then you're going to spend some period of time, years, and in this period of your training. And then you'll have to decide if you did an MD or an MD PhD, are you going to continue with clinical training? Most likely you will. Most people do. So you're going to have to pick a specialty for residency. And nowadays, most folks, not only do they pick a specialty like internal medicine or surgery, they're also going to pick a subspecialty. So I'm a pathologist, for example. So within pathology, you might subspecialize within a particular organ system of the body and only focus on pathology of a particular organ system. If you're in internal medicine, you might pick infectious diseases. If you're in surgery, you might pick a specific type of surgery. And that's really kind of the expectation these days, and especially in academic medicine, that you're going to have not just a specialty, but a subspecialty. And I think things to think about when you're trying to decide what specialty and where to do that specialty. Again, if you're trying to be a physician scientist, you want to make sure that there's enthusiasm and support for you doing research if that's what you want to continue doing, and that there's some protected time for you to start to get your feet back into the research realm. Some clinical residencies are really, really busy, and you might not have as much time as you'd like to do research. So just kind of want to be thinking about that. And then most physician scientists do some period of a research fellowship that may be integrated with their clinical fellowship, or it might be a separate postdoctoral fellowship. And again, the key question there is, do you have supported and protected time to fund you and to protect your time from having too many clinical duties, so that you can really focus and become an expert on some area of research? And then finally, once you've gone through all these hoops, you're hopefully going to get an opportunity to join a faculty somewhere at an academic institution. And I think a really key question or consideration when you're trying to make that decision is, are you going to have, what's your clinical research balance going to be? And are you going to have, again, the time to really focus on the research, because that takes a lot of time? And are you going to get to practice the kind of clinical medicine that you want? Does the institution have a need for your clinical subspecialty? So I think there are a lot of decisions to make along the way, a lot of things to navigate, but I think that along the way, having good mentors to help you think about some of these considerations and give you feedback and insight about particular programs and institutions is really key. And so I think another thing, as I mentioned, it's a long training period. And so I think it is important to just kind of lay out what the timeline would be for somebody who does a joint MD PhD degree. So starting from graduating from undergraduate, your undergraduate degree, some people, before they start, they're going to medical school or graduate school or an MD PhD program, nowadays will do a year or two of additional research or clinical experience just to really cement their interest in the field. So after that, you start medical school, which would be 4 years. If you do a joint MD PhD, it ranges between 7 and 9. The average is kind of about 8, but 9 is not unheard of. And then for your clinical residency and subspecialty training, if you do a clinical fellowship, that can be between 3 and 5 years, minimum of 3 years, potentially even longer if you're doing something that requires a lot of clinical training like neurosurgery. And then your research fellowship, should you choose to stay in research, that could be another couple of years while you're, again, developing your expertise and starting to get some of your own funding and develop independence. So I do think it's important to think about the timeline for a typical MD PhD training period. And of course, challenges, as I mentioned, long training period. It can be difficult to really master 2 fields, both your research field and your clinical field. And I think one way to kind of approach that is to try to think about having a research program and a clinical program that are really complementary and as much overlap as possible. But I think despite those challenges, I think being a physician scientist really does provide some unique perspectives. And I think having the clinical connection and knowing that you're helping patients and that hopefully your research will one day help patients is just really, really rewarding. And so, if I had to go back, I wouldn't do anything differently with my training pathway. Any questions that I can elaborate on?
Okay, I have a few questions.
Yeah.
Okay, so you have mentioned that it can be difficult to master 2 fields, especially when you're being trained to understand health and disease from a clinical and a scientific perspective. Mm-hmm. So as an MD PhD, do you ever feel less focused And if so, how do you move about that confidently?
Yeah, that's a great question. You know, it definitely can feel less focused. You definitely feel that push-pull. I think one strategy to help with that is to really focus when you're doing the clinical work. You really focus on the clinical training. When you're doing your research training, you really focus on your research training, and eventually, once you've gone through all these stages, you kind of bounce back and forth. You're doing research, and then you're doing clinical, you're doing research, you're doing clinical, and at the end, you're finally integrating it all. So one of my mentors used to say that there are seasons and times. So, when it's your time to be doing clinical training, again, you really focus on that. When it's your time to be doing the science training, you really focus on that so that you really have those skills really well honed. So that when you take a break from that part of your training, when you come back, you still have that foundation.
Right.
And understanding that the learning curve is going to be probably a little bit steeper, and that's okay. Because I think it's worth it to understand both sides of the coin, the clinical side and the research side.
Amazing. My second question was because I'm transitioning out of high school and I'm realizing just how long 8 years is. So because specifically the MD PhD program is so long, what are some of the lessons that you learn along the way? Because I assume your first year is definitely different from your 8th year.
Yeah, it's really different. And I think that a lot of life happens between, let's say you're 22 and you graduate college and you do an 8-year MD PhD and you're 30. When you're done, a lot of life happens. And I think that one lesson that's really important is you can't put your life on pause. If you have family and that's something that's, or having a family is important to you, that's something that you shouldn't put on pause during your training. It certainly makes it more challenging, but that's something that can be prioritized. Friends are really important. Hobbies are really important because it is a long, slow training path.
Right.
You can't put the rest of your life on pause. I would say that's something that's really important to keep in mind.
Okay.
It's a marathon, not a sprint, I guess.
Gotta learn how to pace yourself.
Yeah, maybe an ultra marathon is a better analogy.
Okay. And then my last question was, if you can do research as an MD, then what is the point of taking that extra step and doing the MD PhD program?
Mm-hmm. Yeah. So, I'm probably a little bit biased because I did do the joint degree program. But I think it does, give you more rigorous scientific training. At some point, you have to get that scientific training. And if you do a straight MD program, you'll get that during your postdoctoral fellowship, but it might take a little bit longer. So I think it gets worked in there somewhere, and it's just kind of, do you want to do it in the middle of medical school or do you want to do it after all of your residency training? I'd say the other really practical consideration is that medical school is expensive, quite frankly, and most MD PhD programs are funded. And there's a tremendous amount of pressure, once you are through medical school, if you have an MD, to start thinking about loan repayment and paying back your loans for medical school. And that makes it hard to stay in academic medicine and hard to keep doing research. So, I think that doing an MD PhD program that's funded can kind of buffer you from some of that pressure.
Right. Okay, that makes sense. That's all of my questions that I have today, Dr. Carey. I really want to thank you for joining me once again.
Absolutely. It's my pleasure, Kennedy. Thanks for inviting me to talk about my career path.
Okay, well, you have a good day.
Thanks. Bye-bye.
Bye.